Hi everyone, my name is Ethan Cetina, and what I'll be talking to you about is a research article that was titled, Does Television Make Us Think We Can Prevent Cancer If We Watch Programs About it? Also, how cultivation theory played a big part in the findings of this study. This article discusses about television makes us think that we can prevent cancer if we watch programs about it, whether it's like a Dr. Oz, Dr. Sanjay Gupta, or just local television that talks about the cancer prevention, whether you're eating healthy, eating the right things, or eating something in particular that helps prevent cancer. I know when I was growing up that carrots helped improve your eyesight. Well, now they're saying a lot of like fruits and vegetables um, are helping reduce the chances of getting cancer, especially if you don't smoke or you don't drink. We'll start off with a little bit of statistics of previous studies that said, first off, approximately 30% of U.S. cancer deaths are attributable to smoking, whereas 14 to 20% are attributed to overweight and obesity in the U.S. Again, in the past few years, smoking has become really big, as well as the rise in cancer deaths. Cancer has pretty much become the number one disease in today's day and age. And with that being said, we really worry about whether or not we're doing the right thing, if we're going to catch it, not going to get it, or when we do get to that 80s age, or the golden years, as some people refer to it as, what can we do to prevent it to help miss it that much longer? What researchers did in this study was they had members of TV watch cancer television shows about cancer day in and day out, and see how they reacted to it, whether it was good, it was bad, or how they thought about it. Also, they want to know how it puts people in the line of thought and how much it played a role, like whether what we see on TV is what we really believe and what we perceive as being real or fake, and what makes us think what we can do to help prevent that. Whether we watch a television show about blueberries helping slow down the chances of cancer, or the big one now is medical marijuana helping reduce the side effects of cancer, or just helping ease the pain of it. The researchers did use the cultivation theory, which I was surprised with the results of showing that most people who watch TV about the cancer, the prevention, were actually influenced by that. They started doing the things they saw on TV, thinking that it was going to help prevent them, with no actual results showing whether or not it did or did not help them. And with that being said, it just shows that we intake information and we choose to live with it or live without it. Most people chose in this study to take the information to heart and really follow it almost like in a ritual OCD fashion, because they were afraid of getting cancer. No more information was being told about how the people got cancer, or whether or not they could check themselves to see if they did have it before the study or after the study was completed. Not that many people said um, they had received cancer unless they were a smoker or overweight, or if it was a previous health issue. So, in my opinion, it really didn't show whether or not the prevention of it. It just showed that what we do is how we intake things. Um, with the study being conducted, study one was with TV, and study two is done with newspapers. The study one showed a significantly more percentage, with 65% showing that people followed it more ritually, while the study two with the newspapers was only about 29%. And with that being said, it just shows that as long as we're watching something and somebody's telling us about it, and we're not just reading it and saying, "Oh, hey, that says that such and such prevents cancer," we really don't follow it unless it's actually being projected on the television, because most people believe what's on TV is actually what is true. And that being said, um, I felt that they could do the survey again, as I said before, in this day and age, cancer has pretty much become the more number one death disease, especially in the U.S., because we really don't know a lot about it and how we can prevent it. And there could be more prominent disease, effects of it today, even if we did more studies about it. And with this study, it really didn't show how people were preventing it or what was being showed to them. It showed how they could go about trying to prevent it, or what was being showed to them that showed us what they could do to help prevent it, and what was believable, what wasn't believable. The study didn't mention whether or not the information being told to them was actually realistic, or if it was just somebody videotaping a report in their back office with that. And This also would have been an interesting study since we know a little bit more a little bit more about cancer now than we did probably 20 years ago when this first study was conducted back in the 1980s. It was just a very minor study. This study that I'm talking about right now was done back in 2002, 2005, and it dealt with right around 1,500 participants. So we had a good idea of how people reacted to it and what their thoughts on it were. And with that being said, it shows us how easy it is to manipulate people, especially with the cultivation theory. This was a very good example of that. That what we perceive in today's day and age also shows us how we can just absorb information and just spit it back out and just tell somebody because everybody talks about everybody behind somebody's back. So if Susie Q says about how blueberries help to prevent cancer, then Martha's probably going to do the same thing. And just if she sees a special out of it, they're more likely to follow it and just again do that OCD reaction kind of thing. So this is a study I would have liked to see done in a more maybe like the late 2008, maybe 2009, a little bit more later, and just seeing what the results were if it was the same effect because people are now on their mobile devices, their TVs, their laptops, iPads, and just seeing if now with technology being a major part, if it would have changed the results at all or if it would have just been the same. So, already, thank you.